Global health is a worldwide state of complete physical, mental, and social well-being, not merely the absence of disease. There are many different types and stages of mental health conditions, some of these being acute sudden conditions and some being chronic long-developing conditions. Traumatic events happen to those all over the world. 3 traumatic events that have damaged the mental health of millions of people around the world are Hurricane Katrina, the war in Iraq, and cancer.
The day before Katrina hit, New Orleans mayor issued the city's first ever mandatory evacuation order. The Saffir-Simpson hurricane scale categorized the hurricane as a Category 3 rating. The storm itself did a great deal of damage, but its aftermath was catastrophic. It seems the federal government was slow to meet the needs of the people that were affected by the storm. Hundreds of thousands of people in Louisiana, Mississippi, and Alabama were displaced from their homes. Experts estimated that Katrina caused over more than $100 billion in damages. Many people that survived this traumatic experience were left with high anxiety, depression, and many other mental health issues. While war affects everyone involved, such as civilians, family members back home, and soldiers, PTSD has a strong effect over those fighting in the war. Soldiers that fought in the Iraq War were at high risk for injury and death. They were constantly on the clock and witnessed many things such as seeing others hurt or killed. This puts them at high risk for PTSD. The reasons that they are not getting treatment are because they are concerned with being seen as weak, concerned about their privacy, or had problems accessing such costs or the location of treatments, and they potentially are concerned about being treated differently. Cancer is a disease that is caused by an uncontrolled division of abnormal cells in the body. People who have cancer may find the physical, emotional, and social effects of the disease to be extremely stressful. Evidence from experimental studies suggests that the psychological stress can affect a tumor's ability to grow and spread. Patients can develop a sense of helplessness when stress becomes overwhelming. People who feel hopeless do not seek the treatment when they become ill, which lead them to giving up on their helpful therapy. Some people tend to engage in risky behaviors such as drug use or do not maintain a healthy lifestyle, resulting in a premature death. Cancer survivors who have other chronic conditions or health risk factors at the time of diagnosis may face additional challenges during their cancer treatment and follow-up care.
Mental health of trauma survivors and all people should not be overlooked. There are different ways for us to make a difference. By creating support groups and funding these groups to be successful, and through funding new hospitals for people to have a place to go, we become one step closer to making mental health a topic that is talked about and treated. There are many ways you can help yourself and those around you. Through getting professional help, connecting with others, staying positive, getting active, helping those around you, getting enough sleep, and developing your own coping skills, you can become one step closer to having a healthier state of mind.